Good morning, everybody. Pleasure to meet you. Alex Bolanos with United Surgical Partners. I'm the VP of Corporate Development, and I head up the M&A activity for USPI on the West Coast. I've got to say I was a bit humbled this morning as being the largest owner-operator of ASC as I had a discussion with Dr. O'Neill from Twin City Orthopedics. And just when I thought that we were a great manager, I got to hear about all the fantastic networks of ASCs have been able to build in the Twin Cities area. Quite impressive, and again, congratulations for a job well done. As I was thinking about some of the comments that Sarah had made regarding the OR efficiencies, if we're looking at the most basics that are needed in a successful ASC, it really comes down to volume and it comes down to rates. You've got to have both of those in order to succeed, and then everything else essentially falls into place. What I wanted to do is just provide a little perspective in terms of some of the market trends, talk about what we're seeing on a national basis, then we'll quickly jump into how to select a partner in the ASC industry. I share this map not to have a shameless plug for the company, but really to talk about what's been happening over the last 5 years. Our organization began in the Texas market and the first relationship with Baylor Scott & White back in 1998. And over the 20-year period, we were able to build about 240 ASCs across the country, across 30 states. In 2019, we had 230 centers. In 2019 to 2022, we essentially doubled the number of ASCs in our portfolio. And that happened for a couple of reasons. The primary reason was that we're seeing a major shift from out-of-network centers into in-network. And we're also seeing some pressures from independent ASCs that have not scaled on a regional basis, unable to contract with some of the bigger payers across the country. We happen to have the good fortune of aligning with a lot of health systems. We also have our own rates. And by virtue of having those two value-added offerings, we've seen a huge shift in the portfolio over the last 3 or 4 years. A lot of this information is data that was shared the last day or so. It aligns to some of the national total joint data that we're seeing in the ASC and the HOPD. As you can see from the orange line, that represents the hospital inpatient volume coming down. The green line represents the number of cases that have migrated into outpatient. And the line at the bottom, the blue line, really shows the growth that we're seeing on the ASC side. And I think there's not a direct correlation in that growth, and I think it's important that we really focus on the patient selection process on the ASCs. I think that line will continue to grow. This line just represents the total joint volume that we're seeing across a national basis. But if you were to overlay the totality of musculoskeletal procedures and orthopedic procedures, that line would have a pretty significant spike that would match the green line in the outpatient setting. In terms of some of the growth that we're seeing within the company, again, 2019, 2020, we had around 6,600 total joint cases. And then with the additional acquisitions, we're now spiking north of 26,000 cases for 22. The chart on the right basically shows the data with surgical hospitals. Again, in 2019, you can see the blue line at 83%, and then migrating down to 26% in 22 with an increase of the total joint cases outpatient shifting to 62% across 13 surgical hospitals. A lot of this is due to the enabling technology that we're seeing. The red line and the blue line here shows what we're seeing with navigation, with robotics. Out of the 450 or so ASCs that we have in the marketplace, we have about 200 centers that are now doing total joints. About 40 of them are doing it with robotics as well. So when we were talking about the shift of those cases, robotics really wasn't in the conversation 5 years ago. Now that a lot of the capital equipment companies, device companies are now showing some pretty creative programs and being able to build and bring that technology to your ASCs, we're able to bring that technology to bear and have it be a pretty strong value-added offering for our centers. To get to the meat of the discussion here, so as we were talking about the choices that are available today, much of this discussion really revolves around de novo centers and new acquisitions, the de novo centers, but it also applies to acquisitions. So when you look at the three partner types, you've got management companies, you got health systems, and you got private equity. I think it's important to look and compare and contrast what they bring to the table. From a management company perspective, some of the easy things to look at from a pro, you have access to capital, rapid decision-making. A lot of the larger management companies have access to payer contracts, a lot of leverage with supply chain savings as well. And then you have operational excellence, and then also a very strong de novo expertise and subject matter experts that come with that. The negative part about the management companies is that we often lack access to patient networks, and some of the smaller companies don't have access to some of the payer rates. You shift over to the health system. A lot of you who have ASCs might already be partnered with a not-for-profit health system. Historically, the value that they would bring to the table is that they would have the ability to bring regionalized payer contracts. They'd be able to align their narrow networks, and they would also allow their medical groups and the foundations. If you're in California where you can't employ, you have the foundation model that can actually bring and deliver volume. That was a value-added play in theory. We're now seeing a shift away from that. Our model within USPI is that we partner with about 50 of the largest not-for-profit systems around the country. You all have seen the challenging financials that they've had over the last couple of years. Common Spirit, Providence Health, you name the not-for-profit, they're losing billions of dollars a year. We're seeing staffing costs go through the roof. We're seeing changes and shifts from the payers moving more and more cases out of the hospital and into the ASC environment. So now as you start looking at a health system for alignment, you really have to start asking yourself the question, what value can they bring? Sarah provided a great example in one of her markets where the health system was able to increase the Medicare reimbursement from the payer reimbursement from 180 to about 220% of Medicare. That's the analysis that you have to really do today. What value is the health system bringing? Can they deliver rates? And can they deliver volume? Those are some fundamental questions to ask. The last piece is really on private equity. For all of you that own an ASCs today, you're probably getting weekly calls from private equity asking about buying the practices. So they do serve a purpose. I think the pros on this is that you have quick access to capital, rapid decision-making, very aggressive multiples on your practice, and attractive exit for a lot of the physicians that are looking to retire within the next couple of years. And of course, they can provide you the ability to scale across all of your ancillaries. So if you're looking to be relevant in a market, in a region, and you want to expand with ASCs, rehabilitation services, and you don't have the capital to do it, the private equity route is a good way to go. The negative side about it is that they do have limited access to contracts. They have no leverage with payers. They don't have much in terms of controlling patient lives. And then the other piece is that they lack a value-based knowledge. So as you're looking at the shift to value-based care, there's not a lot of private equity that really understands that model and how that all functions. And then lastly, if you've got some younger physicians in the practice and you go the private equity route, they might find themselves in a more challenging situation having to work for bankers versus working for a medical practice. So just a couple of considerations in that process. Whatever you decide on, make sure that you've got a partner that really focuses on a partnership culture, one that focuses on physician consensus at the governing board level. You want to make sure that you've got some operational synergies, that they can provide some cost savings through your supply chain. You want to make sure that they've got a track record of success in the markets that they serve, be able to reach out to other ASCs that they partner with, talk to the physicians, see how they're doing financially, see how the governance works, and make sure that you have access to that kind of referral pattern. With respect to strategic planning as well, as you're starting to launch new service lines, also make sure that they've got subject matter expertise in order to be able to help and assist and bring those services to bear. And then lastly, you want to make sure that you've got an organization that keeps you compliant across all the changes that are going on right now with the government. From a de novo perspective, a couple of key considerations. This is a pretty traditional model in terms of an expense structure. You look at a 10,000 square foot ASC, 3 ORs, 1 procedure room, 10,000 square feet. Based on today's costs, it's about an $8.5 million project. So the question you have to ask yourself as a practice, do you have the financial wherewithal to fund this? Do you want to fund it through equity contributions? Do you want to fund it through debt financing? Those are all questions that you have to overlay as you start considering the management company, private equity, and the health system. And these are a pretty simple breakdown of costs that are involved with these de novo projects. The timeline on this, again, it's about an 18-month process. So whoever you partner with, make sure that they've got expertise in doing feasibility, the syndication process, construction and planning, and then a lot of the pre-construction that goes through the certificate of occupancy process as well. All things that you have to consider through that selection process. The most important part that I would say in terms of determining an appropriate partner is really asking yourself the question at the bottom of this slide. You got to compare the math and determine if diluting your ASC ownership with a partner makes financial sense. So you got two pro formas that are sitting up here. In any situation where you're looking at a partner, make sure that you run your pro forma using rates and using volume that you know that you can get into that local market. Compare that to what the partner is projecting, and then figure out if that financial return is worth your dilution. And if the answer is that at the end of the day, they're not delivering volume, they're not delivering rate enhancement, all they're doing is diluting all the distributions that can be going to 100% of the partnership. The ideal situation is that if you have an ASC where you have a company or a health system that now wants to control and consolidate and own 51% of the center, the outcome of that relationship, that ownership, better yield, better returns at the end of the day. So you might have a situation where you've got a year 2 distribution set up at about $860,000 on your own by year 3. In this particular model, by partnering with maybe a health system and maybe it's a management company, those margins go up to 37%. It's the $3 million bucket of net income before taxes, but it's a much bigger piece of the pie versus what you can do on your own. So these are kind of the math equations that you should go through and consider as you're going through this process. And then lastly, with the distribution comparison analysis, again, it falls into the same slide that I just talked about. Again, ask yourself, in your year 2 review, with and without a partner, it really comes down to volume and rates. And I always focus on year 2 because it takes about 2 years to get your center fully contracted. You're going to get your Medicare up and running within the first 90 days or so, but the rest of the commercial payers will take anywhere from 6 to 9 months, maybe even beyond a year. So make sure that you're looking at that year 2 financial as you're comparing and contrasting the various partners that you have available in this analysis. And that's it. I want to be out of respect for time. I want to wrap up over here and make sure that we have plenty of time for the panel discussion. Thank you.